Hi, my name is Erica Croswhite, and I am going to walk us through the ethics of evidence-based practice in this presentation for MCC 530, fall of 2024. This presentation will include an overview of evidence-based practice and what it is, the advantages and the limitations, how it is implemented in managed care settings, the ethics and ethical dilemmas of evidence-based practice, as well as the final takeaways from a personal perspective as I work toward becoming a counselor. So, to give an overview of evidence-based practice, the acronym can be EBP, so I will go back and forth using that language, evidence-based practice or EBP. Our textbook provides a definition of evidence-based practice, saying that it is the integration of the best available research with clinical expertise in the context of patient characteristics, culture, and preferences. And in this way, evidence-based practice is seen through a more holistic lens. Evidence-based practice calls therapists to demonstrate efficiency and efficacy in their practice by being knowledgeable of the current research, trends, patterns, data, and outcomes that exist in research manuscripts and essays and various publications that have been contributed by therapists nationally and internationally to guide our work. It includes research, experience, expertise, and training as a broad overarching concept that guides practice. And it serves as a scientific foundation. And it also sets the stage for quantitative and qualitative analyses that will bolster and do bolster the value and benefits of therapy as an efficacious intervention for many mental, behavioral, cognitive, and social emotional issues. The goals of EBP are to enhance effectiveness of services for clients and to improve public health. And sort of a derivative of EBP is another acronym called EST, which stands for Empirically Standardized Treatments. And these are closely related to EBP and kind of a spin-off. And these empirically standardized treatments are well researched in a controlled environment where the data is analyzed in a research methodology that is quantitative in nature. And with that, many ethical dilemmas and discussions have ensued because sometimes mental health issues don't meet certain criteria that empirically standardized treatments are set out to support or treat. So there are many advantages and limitations of evidence-based practice. The advantages are important. Evidence-based practice provides a scientific infrastructure for therapy practices from which to launch and fall back on. It also provides concrete evidence for specific interventions for specific diagnoses. And in some cases, treatment manuals have been developed that practitioners can follow for specific diagnoses. And those can be quite helpful because it offers a step-by-step sort of treatment plan for clients. In addition, evidence-based resources are available that you can use for psychoeducation for your clients. And the interventions that are offered are based on the best available research. So it gives more backing and just more credibility to various therapeutic interventions. However, the limitations of evidence-based practice are also quite important to consider. So oftentimes EBP doesn't include the therapist's theoretical orientation. Also, some interventions are easier to measure than others. It is believed to be a mechanistic approach that sometimes dismisses the relational dimensions of the therapeutic process. And the complexity of human change and human changes, it can limit the reliability and validity of EBP in research. Also, clients might not have a well-defined psychological disorder that is associated with EBP, and they find themselves in the gray, which can limit the way that EBP can be used to support certain treatment methods. When it comes to managed care systems and evidence-based practice, empirically standardized treatments, ESTs, managed care systems sort of like this model because they provide parameters for insurance companies. It provides limitations on the length of therapy. It also provides some standards for what would be the most minimal intervention necessary to help a client reach their treatment goals. And that is really based on how to manage costs. But having that expectation of precision therapy is difficult when a client's issues don't match the ESTs that are available. However, EBP and ESTs are favorable from a managed care perspective because they provide concrete, standardized information that can then be forecasted when they're thinking about their business operations and their financial status and what they can and cannot cover. Short, standardized therapeutic interventions are sometimes easier to justify when you're determining business operations. And managed care contracts are often evaluated on their ability to manage costs and their ability to manage brief methodologies or brief interventions. And in that way, there is pressure to demonstrate the efficacy through a standardized approach, even when it comes to mental health services. So the ethical considerations of EBP are pretty vast. Evidence-based practice, it's helpful when a client does present with a specific issue that has been well researched. And there are good metrics and there are good outcomes associated with specific interventions. But it's not all encompassing for all clients and all issues for why people seek therapy. Also, when we focus on evidence-based practice as the main priority of our therapeutic interventions, we are excluding the therapeutic relationship, the therapist's personality and style, and the client's role in therapy, as well as environmental factors. Also, EBP is not equitable across all therapeutic approaches because it's not easy to conduct in certain types of therapy or environments, and it is easier in other types of therapies and environments. Efficiency and efficacy and safety all remain a focal point of therapy, but sometimes they cannot be controlled and studied and measured in the same ways across different types of modalities. And sometimes they're seen to have a narrow focus, but at the same token, Managed care businesses use those to guide their business decisions and operational practices. And it can get a little tricky. Also, one last thing, the active role of clients and their culture and their preferences and values may not be accurately captured in EBP or ESTs. So my final takeaways are that practice-based evidence is the opposite of evidence-based practice, and it serves as an alternative framework, which is a fascinating concept, but it also can be used to demonstrate efficacy, efficiency, and safety of therapeutic services. EBP might favor one approach over another, which could contribute to bias. However, financial considerations have to be considered when you are working in a managed care environment. I think that incorporating EBP is an essential element of therapy, and it should be part of the larger holistic picture. We need to engage in ongoing conversations and discourse about EBP and its implementation and its potential, and ongoing research is absolutely needed to bolster both the qualitative nature of EBP as well as the quantitative nature when we look at all different approaches to therapy. So I'll close with this last quote about if counselors are conducting research, what is required of us? And we do want to contribute more research to this field, and we want to be creative in how we do that. And we are guided by our ethical principles. And here are my references.